Let's talk about my favorite top strategies for pain with sex. So today we are going to talk about practical tips that you can implement right away into your own routine and your own life to help either reduce or completely eliminate pain with sex. So first thing we need to talk about is that typically speaking, not all the time, but typically speaking, if you are experiencing pain with sex, your muscles are likely what we call overactive, meaning that they are just simply holding on too tightly, they have too much tone, too much tension in them, or sometimes the muscles themselves inside the pelvic floor that support the vaginal canal, sometimes they are just straight up painful for whatever reason that may be. So the ways that we can help relax those muscles and decrease the pain, they're through various strategies, but I'm going to teach you some of those strategies right now. And in this video, we're also going to talk about a couple main sex positions and how to modify those sex positions to help decrease or eliminate pain completely. So first things first, I really want you to think about relaxing your pelvic floor. Now, how do you do that? Of course, that's the million-dollar question. One of the best ways and one of the simplest kind of foundational ways that we can really help to relax our pelvic floor is by making sure we are in tune with our body's breath, and especially with diaphragmatic breathing. So with diaphragmatic breathing, what we want to think about is what I call 360-degree breathing. So that means that not only the belly is kind of coming up, chest is rising slightly, rib cage is moving side to side, so it's expanding through the sides, and even your back is moving a little bit away, so this way. So in other words, when you take a breath in, the whole trunk canister per se should be expanding, and we want to think about directing that breath. I like to call it direct that breath downward towards our pelvic floor. And the reason why that happens that way, or why this is so important, is because our diaphragm is the main muscle of respiration. It pulls down to allow there to be space inside of our chest for our lungs to fill up with air as we breathe. Well, our diaphragm works symbiotically with our pelvic floor. So obviously we all know we have organs inside of our trunk, inside of our stomach, right? So we've got our stomach, our intestines, our pancreas, appendix, gallbladder, all that fun stuff, right? So when we breathe in, our diaphragm moves down. Well, we've got organs there. So the organs have to shift a little bit too. And our pelvic floor at the bottom, the floor of our trunk, it should move down a little bit. So we should always tie relaxation of the pelvic floor with breathing in. And I know that may sound really strange, especially if you haven't worked with me in person. A lot of people think as like a way to relax, right? But we actually want to think about breathing in and opening, kind of blooming, blossoming through the pelvic floor. So when it comes to sex particularly, first thing I want you to think about is really breathing in deeply. Imagine letting go. Imagine, I call it sometimes like vulva doors that are swinging open at the bottom of your pelvis. You can also think of it as a pair of lungs inside of your pelvis. You're breathing, inhaling, everything's opening, expanding. So breathe in, especially with initial penetration. So this can help relax the pelvic floor and help things to be less painful, if not completely reduce the pain altogether for you. The next thing I want you to think about is letting your tummy go. So I think that a lot of us, just because of either the way we were raised or just society in general, the pressures of society nowadays, we tend to suck in, like hold in our stomachs a lot, for whether we are just trying to look a certain way or unconsciously or consciously fit what the expectations are or the beauty standards of today's day and age, whatever it is. But when you suck in or grip your abdominals super strongly, your pelvic floor responds to that, and it will also contract and turn on. So during sex specifically, think about letting your tummy go. I often tell my clients when we're in the clinic together working on exercises, I say, let it hang, just let it go. And the reason why I say that is because when we let our tummies go, our pelvic floor will relax and lengthen as well. Another really important concept to think about is our jaw, or our jaws. So the reason why thinking about collectively our jaws in particular is important is because there is a fascial connection between your jaw and your pelvic floor. Fascia is just simply connective tissue that's inside of our body that envelops our organs, our muscles, our nerves, etc. And so the thing is that if we are clenching, holding our breath, right, or grimacing or anything like that, or with a fear of pain or potential pain, that's going to just squeeze up and clench up the pelvic floor as well. So if we breathe in, if we loosen our jaw, open our mouth, keep everything relaxed up here, that can help the chances of our pelvic floor be relaxed as well, which can help decrease or completely eliminate pain as well. Okay, so those are some of my favorite strategies right off the bat when it comes to pain with sex. Let's talk about sex positions next, okay? So I'm gonna start off, we're gonna just dive right in into doggy style. So for doggy style, if you're having pain with doggy style, so let's say your partner's a man and you are in front, obviously on hands and knees, and he is entering from the back, if that is painful for you, if you can't tolerate it, if it feels like he's hitting your cervix, these are a couple things I want you to think about. So like I mentioned before, first things first, breathe in. You are going to think about letting go of your jaw, unclench your jaw, let your tummy go, let it hang, whatever it is. He can't see it from the position he's in. Regardless, whether it's a he, a she, whatever, whoever they are, they won't really be able to see your tummy from that position. So just let it all go, let it relax. And the last thing I want you to think about is your pelvis, thinking about the angle of your pelvis. You can either arch your back and kind of angle your pelvis, kind of tilt it forward, or you can even think about rounding your back a little bit, kind of almost tucking your pelvis underneath. And that's a way that you can help change the angle and see if that helps to reduce the pain. Now, before I continue with the different positions, I want to say that you can always include pelvic floor stretches right before sex. For the sake of this video, I'm not gonna go over pelvic floor stretches in general, but just some of the common ones that you can think about, you can look these up online. Happy baby stretch is a great one. Child's pose stretch is another great one. Deep squat is a great one, or a supported squat. Anything that you can do to kind of help open up the pelvis and open up those muscles while breathing really deeply, that's gonna be great for your body. So we've got doggy style, we talked about that. Next one that we're going to talk about is cowgirl. So this is woman on top. We're gonna pretend, just for the sake of this video, we've got a man and a woman couple, but this applies to really, it doesn't matter what the combination of people are, but let's just say we're talking about from a woman perspective, an individual with female anatomy. These are the tips I'm giving for you as that person. So cowgirl, woman on top, first things first, same thing, same concepts, letting go of any tension in the jaw, in the face. We're gonna breathe in, we're gonna let the tummy go. Big things here that we can think about are either tilting the pelvis once again, so you are on top straddling your partner. You can think about kind of rocking forward or even tucking back. Another big thing I often suggest for a cowgirl or a woman on top is resting your chest forward. You can even like go all the way and rest your chest forward onto your partner's chest. And then lastly, you can think about how wide your knees are. So you can think about either bringing them really, really close so that your legs are much more narrow, so they're really close and kind of sandwiched. You're sandwiching your partner's trunk in between your legs, or you can think about widening your legs. So play around with those different suggestions and see if any of those help you feel better and help reduce the pain for you. Next position that we're going to talk about is side lying. So side lying, this is the spooning or the cuddling position, however you want to think about it, but we're going to think of you in the front, partner is behind you, cuddling you from the back, entering from the back. So big things that I typically recommend for this one are going to be a pillow in the middle of your knees and your feet, so supporting. So as you're laying on your side, you have a large pillow supporting your knees, I should say, and your ankles. So this is going to help keep your whole lower half in line. This can help with the neutral position of your pelvis and of your spine, and this can be a really nice way to keep things supported as you're enjoying intimacy to help reduce pain. Other ways and other strategies that you can do to help address pain during intimacy in side lying, you can play around with the position of your knees. So what I sometimes recommend is either bringing your knees up, kind of tucking your knees up towards your chest. You can do one or both, or what you can do is straighten your legs out. Once again, this changes the angle of pull of those muscles inside your pelvis. And of course, there's no such thing as one size fits all, so you have to kind of experiment and see which position and which modification of that position feels best for you. Next position is prone. So this is you on your stomach, partner entering from behind or from on top, I guess I would say. So once again, you are laying on your stomach. A big thing that I often recommend for this is a pillow underneath your pelvis so that your pelvis is elevated into the air. And so this once again changes, all these modifications and suggestions are simply to change the angle of pull of those muscles and to see if we can get those muscles to relax more so that they are not as painful. A couple other things with you laying on your tummy are going to be legs either super close together, touching each other, or legs a little bit more open. And you can play around with that and see which one feels best. Typically speaking, legs together are going to keep everything nice and close and together. And if your legs are super wide and spread apart from each other, that does kind of stretch through the inner thigh muscles. And the inner thigh muscles we know that connect up into the pubic bone, which is also where the pelvic floor muscles connect to. So you'll have to play around with that. Most times, legs together tends to feel a little bit more comfortable, but you can play around with that and see what feels best for you. Last but not least, we have classic missionary position. This is a favorite for good reason, but missionary is woman on bottom, and for the sake of this video, we're talking about a man on top, but once again, this can be a female with a toy or whatever it is, right? So let's just pretend man is on top, female is on the bottom. Once again, we can think about a pillow underneath the pelvis, lifting up the pelvis there, giving there to be a slightly different angle. And then I always say play around once again with the leg position. So legs can either be wrapped around partner or legs can be close together and partner's legs are outside of your legs. So there you have it. Those are my top strategies to think about during pain with sex and to address pain with sex. Big focus and big takeaway for this video is simply the fact that we really want to focus on relaxation and we want to focus on modifications and ways that we can strategize to help change up the positions so that sex ends up being more comfortable for you to enjoy. Take care, and I'll see you in the next video.